Hi everyone, welcome to week 2 of your Pharmaceutical Career Planning 1 course. This week we're going to be covering chapter 3, which is all about long-term care pharmacy. When we think of long-term care pharmacy or long-term care in general, we're typically thinking of anything related to a long-term care facility. So this is a pharmacy that's going to dispense medications to anybody in a long-term care facility. So that could be a nursing home, but it could be any other type of long-term care facility as well. So, maybe a mental health center, maybe a prison. All of those types of things would fall under long-term care. So kind of just keep that in the back of your mind as well. Long-term care pharmacy typically kind of depends on where you're at. If you are in a very small town, the actual pharmacy that services the long-term care facility may just be a retail location. It may be the local pharmacy, and they actually, dispense the medications and they send them over to the long-term care facility. That would be an example of what they call an open shop pharmacy. So they would dispense medications for that long-term care facility, and they would also have their own retail or walk-in clients. Then there's also closed shop pharmacy, and this is typically the type of pharmacy that services many facilities at once. So not just one particular location, but several locations. I used to work for a company like this. We were actually bought out by Omnicare several years ago. So if you're familiar with Omnicare, that's an example of a closed shop pharmacy for long-term care residents. So basically, what you're going to see in a long-term care pharmacy is some of the same things that you're going to see in a retail pharmacy. You're going to have a pharmacist, you're going to have a pharmacy technician, but you're also going to have a delivery person. You're also going to have some sort of billing folks. So somebody who handles all of the billing for the residents. So the pharmacist has a couple of different roles depending on what they do for the long-term care pharmacy. Some are going to be part of the actual dispensing. Some are actually going to be doing what we call med reconciliation. So they're going to actually go to the location, to the facility, and they're going to look at the charts of the patients. They're going to look for things like drug interactions. They're going to look for things like maybe too many drugs of the same type. Maybe we're treating a condition with more than one type of drug that, so drug overlap, that kind of thing. So there's a lot of different functions of a long-term care pharmacist depending on what they do. And then we have a pharmacy technician who's going to assist the pharmacist depending on what area they're in. So lots of different things going on there. And then, of course, the delivery person is going to bring that medication to the long-term care facility. We actually had several delivery people. They went to each facility on a daily basis for the most part. Some of our facilities that were further away only got deliveries every couple of days, but it just kind of, again, depends on how that particular pharmacy is set up. And then, of course, the billing representative handles all of that. So typically the pharmacy is separate from the nursing home itself, so they're going to be doing their own billing. So it's not going through the nursing home, so you're not being billed by the nursing home for your medications, you're being billed by the pharmacy. And then, of course, we have inventory. We have to have the same type of inventory that we would in a regular pharmacy, but of course there's going to be certain things that are specialized for those residents. You're going to have to think about how that medication is prepared and packaged. So that is another big thing when it comes to long-term care pharmacies, is how do we deliver that medication? And unit dose is typically the dispensing mechanism. So there are single unit packages, and then we also have what's called a punch card. So we did a lot of punch cards, so it would be actually look like an actual card, and it had all the medication had was in there for 30-day supply. So if I had one particular package for one particular drug, it had that particular patient's name on it, the directions for use, etc. and then the nurse would just punch that particular drug out each time they pass meds. So that's what a lot of the facilities are using. They also do use what's called a blended system, which is where we are using automated cassettes, things like that in the facility. So lots of different and kind of unusual things that you're going to find in long-term care pharmacy. And as you go through this chapter, if you have any questions about it at all, please make sure that you reach out to me, and have a great week.